Thank you, everybody. I hope this isn't going to disrupt the magnificent flow of the order of the speeches, but while I was getting my picture taken, they came in and said, the limo's ready. And they tried to take me, and I wanted to at least say hi after flying 6 hours. It didn't make any sense to me. I've really had a good time here today, this time, and I can't believe that I don't want to leave. I usually plot to run out of meetings, and I don't want to go. I've learned a lot, and some of you have redirected my thinking about psychiatrist and addiction medicine. There is real competence in my field if I look hard enough. I started, I guess, 2 times. And I've been thinking about some of the people speaking, and I'm not recovering, although I did give a massively successful talk to all the addiction counselors in New Jersey. And I was told that they were really hostile because they found out I was a psychiatrist, and they felt that our field had done an incredible amount of damage. So the top that I picked was, I talked about being a recovering psychiatrist, and it really went over well. Because the guy that taught me the most, a deceased gentleman by the name of Jerry O'Connor, and I guess it was 30, 35 years ago, I got offended in the beginning until I realized he was right. And what he told me is that you have the personality to work with addicts, but you've got to forget everything you learned at Penn, in medical school, in your residency, if you're going to do it. And I think he was at least 99.5% right. I mean, I was an easy mark. I made all the wrong decisions. It helped that he could predict what I was going to do wrong. And let me talk about another thing that's going wrong, adolescents. I run a rehab. More than half the beds are adolescent. Unfortunately, I'm in the process of deciding to reduce some of those beds because I'm having so much trouble with the state of New Jersey and the reimbursers getting paid. The other thing that's happening to me is a lot of, nothing against your state, but there are a lot of out-of-state rehabs that are cherry-picking patients in New Jersey and Pennsylvania who have better insurances. If they have out-of-network benefits, they can get 30, 40, 50 days in Florida at 80% of charges, which is double what I would get from Cigna or Aetna if I treat them locally. So I might have to have less adolescent patients, even though there are a lot more available. What I wanted to focus on today is the explosion in adolescent heroin users that I'm seeing. And they're not the ones I've been seeing. You know, they're middle class. Mark sent me a young lady maybe 2 months ago. I met her father. As you know, I'm a gimp. I'm going to get my hip replaced as soon as I get back to Philadelphia. I have a special parking place at Lighthouse for 2 reasons. It's close to the door and it's in the shade. All my cars are black, and I live in the car, and I don't want the toiletries to blow up. Anyway, I look out the window, and there's this big BMW SUV parked next to my car, blocking the fire lane. So I come out to make a citizen's arrest, and I realize it's a patient and her father that I facilitated the admission, courtesy of Mark Gold. I'm talking to the father, and he tells me, he remembers we talked on the phone, and he tells me about his daughter's prescription drug abuse that just started a few months ago. And I happened to look down, and it was a hot day. She had her sleeves rolled up, and I could see the track marks down both arms. And with my analytic style, I'm kidding, the analyst said I talk too much, I confronted the father and her right there in the parking lot. You know, and off we went. And if I leave you with nothing today, don't believe everything that's in the paper. You know, kids are binge drinking like crazy. You know, they're dying around me, and they believe if they take a prescription drug, particularly an opiate, it's okay. It's not against the law, even though the prescription's not written for them. And what's occurring is after a while, they can't afford the prescription. And they find out that heroin's a lot cheaper. And off they go. When I was asked to talk a little bit, maybe I should show you that I actually had some slides. This was just published last year, and it's showing first-time use by day by adolescent. And the 25-51, you know, jumped out at me. That's every day of the year. A kid is trying that for the first time. I think you all know this. We're seeing more opiate-related overdoses. You know, in the adolescent and young adult, that's where we're seeing them the most. And they all think they're abstinence. We'll leave that up there for a minute. What I'm hoping, 1 minute, what I'm hoping is that people recognize it. We're not going to stop it. We train people to identify early so that we can get in there before they fried their brain and have a more effective treatment. And I, too, believe treatment results in total abstinence, period. You know, I've treated physicians. I worked for the NFL for years. By the way, particularly with young adults, if you're on top of the testing and you get urine, make sure one of your staff observes it. And I mean really observes it. I learned about that back at Penn. A guy had a dirty urine. I called him in. I told him he's going to the slammer, and he went ballistic. He had a catheter under his penis connected to a bag of urine. He was observed. He opened the stopcock. He got away with it, except the test was positive. Anybody know what happened? The guy paid the money to get the urine was dirty. But addicts are a lot smarter than we are sometimes. You know, I'm a great believer in testing. I wish Dave Martin was here. And I test my staff randomly, too. Thank you. I got the click. All right. I really had a good time here. I really did.
Thank you.
Thank you.